Welcome to Lesson 17, 2026 Nursing Facility Services. In this lesson, we'll learn how to code nursing facility E services using CPT guidelines, medical decision-making, and time. We'll cover initial care, subsequent care, discharge management, prolonged services, and Medicare-specific rules. We'll also review important 2026 updates and common CPC exam traps. By the end of this lesson, you'll be able to identify the correct nursing facility service based on the service performed, documentation, MDM, time, and applicable payer rules. Let's begin with the fundamentals of nursing facility services. Before we begin, let's review the objectives for Lesson 17, 2026 Nursing Facility Services. By the end of this lesson, you'll understand initial, subsequent, and discharge nursing facility services, and how MDM and total time affect code selection. We'll also review the major CPT code families, important Medicare rules, 2026 updates, common coding traps, and CPC-style questions. Remember this basic coding approach: identify the service, determine MDM or time, verify the documentation, and then apply the appropriate payer rules. This lesson is provided for educational and CPC exam preparation purposes only. Coding guidelines and payer policies can change, so always verify the current CPT and CMS requirements before using information for an actual claim. CMS's current nursing facility guidance covers the 99304, 99310 and 99315, 99316 code families and Medicare-specific prolonged service rules. Also remember that 99,318 was deleted effective January 1, 2023, so it should not be taught as a current 2026 annual assessment code. With that foundation, let's begin by understanding what nursing facility services are and when these EM codes are used. Now let's understand nursing facility EM services. These are evaluation and management services provided to patients receiving care in a skilled nursing facility or nursing facility. The services focus on evaluating the patient's medical conditions, managing treatment, and addressing ongoing care needs. For CPC coding, remember that nursing facility services use their own EM code families rather than office or hospital inpatient EM codes. The major categories are: initial care, 99,304 through 99,306. Subsequent care, 99,307 through 99,310. And discharge management, 99,315 and 99,316. Another important point is that nursing facility EM codes are generally per-day services and are reported only once per day for the same patient, provider, and date of service. For our 2026 lesson, we'll focus on selecting the correct code using MDM, total time, documentation, and Medicare rules. So remember the CPC shortcut: SNF or NF right pointing arrow nursing facility EM codes. Now let's look at the difference between a skilled nursing facility and a nursing facility. Now let's understand the difference between a skilled nursing facility and a nursing facility. A skilled nursing facility, or SNF, is reported with place of service code 31. It primarily provides inpatient skilled nursing and related services to patients who require medical, nursing, or rehabilitative care. A nursing facility, or NF, uses place of service code 32. It provides skilled nursing and related services, including rehabilitation and health-related care above the level of custodial care. For CPC exam purposes, remember, POS 31 equals SNF. POS 32 equals NF. For professional EM services in these settings, the appropriate nursing facility EM code family is used. CMS identifies 99,304 through 99,306 for initial nursing facility care, 99,307 through 99,310 for subsequent care, and 99,315 through 99,316 for discharge services. One important point: the place of service identifies the setting, but the CPT code selection also depends on the service performed, documentation, MDM or applicable time rules, and payer requirements. So your CPC memory tip is simple: POS 31, SNF. POS 32, NF. Both, nursing facility EM coding. Next, we'll examine initial versus subsequent nursing facility care. Now let's understand the difference between initial and subsequent nursing facility care. Initial nursing facility care is reported with 99,304 through 99,306. These codes represent the initial nursing facility (M) service and are selected according to the applicable coding rules, including MDM or total time. Subsequent nursing facility care uses 99,307 through 99,310. These codes are used for follow-up and ongoing medically necessary care after the initial service. For Medicare, remember that nursing facility services are per-day services. The same nursing facility (M) service should not be reported more than once per day for the same beneficiary, provider, and date of service. A useful CPC memory trick is 99304, 99306. Initial 99307, 99310. Subsequent 99315, 99316. Discharge. Also remember that a nursing facility setting requires the appropriate nursing facility (M) code family, rather than office or hospital inpatient (M) codes. For 2026, CMS continues to recognize nursing facility services within the Medicare physician fee schedule, and CMS finalized permanent removal of certain frequency limitations for subsequent nursing facility visits when furnished through Medicare telehealth under the applicable rules. The key distinction is simple. Initial means the initial qualifying nursing facility service. Subsequent means ongoing or follow-up nursing facility care. Next, we'll examine initial nursing facility care codes 99,304, 99,305, and 99,306 in detail. Now let's focus on initial nursing facility care codes 99,304, 99,305, and 99,306. These are per-day (M) services used for initial nursing facility care. 99,304 represents straightforward or low-level MDM, with 25 minutes or more when selecting the code by total time. 99,305 represents moderate-level MDM, with 35 minutes or more when using total time. And 99,306 represents high-level MDM, with 50 minutes or more when selecting by time. For the CPC exam, remember the sequence: 99,304 to 25 minutes. 99,305 to 35 minutes. 99,306 to 50 minutes. The code may be selected using MDM or total time, according to the applicable captain rules and documentation. Also remember that nursing facility (M) services are per-day services and generally may be reported only once per day for the same beneficiary, provider, and date of service. The key memory trick is 04 right pointing arrow 25. 05 right pointing arrow 35. 06 right pointing arrow 50. Next, we'll take a closer look at MDM versus total time for initial nursing facility care. Now let's understand how to select the level for initial nursing facility care using medical decision-making or total time. For initial nursing facility services, 99,304 corresponds to straightforward or low MDM, with 25 minutes when selected by time. 99,305 corresponds to moderate MDM, with 35 minutes. And 99,306 corresponds to high MDM, with 50 minutes. When selecting by MDM, evaluate the documented problems addressed, data reviewed or analyzed, and risk of patient management. When selecting by total time, the applicable minimum time must be met or exceeded on the date of the encounter. Total time is not limited to face-to-face time. It can include qualifying physician or QHP activities performed on that date. Here is an important CPC exam point. Do not add MDM and time together. Think MDM or total time right pointing arrow, select the appropriate level. For example, moderate MDM supports 99,305 when the documentation meets the MDM requirements. Alternatively, if selecting by time, the documented total time must meet the 35-minute threshold. And remember the memory sequence: 99,304 right pointing arrow 25 minutes. 99,305 right pointing arrow 35 minutes. 99,306 right pointing arrow 50 minutes. One correction to keep our lesson accurate: total time is not simply face-to-face time. Qualifying time spent by the physician or QHP on the date of service may also count when coding based on total time. Finally, always make sure the documentation supports the selected method and level. MDM tells you the complexity. Time tells you the total time. Documentation supports the code. Next, we'll move to subsequent nursing facility care, 99,307 through 99,310. Now let's look at subsequent nursing facility care, reported with 99,307 through 99,310. These are per day EM services used for ongoing or follow-up care after the initial nursing facility service. CMS confirms that nursing facility EM services are reported as per day services and generally only once per day for the same beneficiary, provider, and date of service. The four codes progress by MDM level: 99,307, straightforward MDM. When selecting by total time, the threshold is 10 minutes. 99,308, low MDM. The current captain threshold is 20 minutes. 99,309, moderate MDM, with 30 minutes when selecting by total time. 99,310, high MDM, with 45 minutes when selecting by total time. For the CPC exam, remember, 07 right pointing arrow 10. 08 right pointing arrow 20. 09 right pointing arrow 30. 10 right pointing arrow 45. And an important correction from older nursing facility materials, 99,308 uses 20 minutes under the current captain framework, not the older 15-minute threshold. When coding, select the appropriate level using MDM or total time, according to the applicable captain rules, and make sure the documentation supports the selected service. So the simple memory line is: straightforward right pointing arrow, low right pointing arrow, moderate right pointing arrow, high 99,307 right pointing arrow, 99,308 right pointing arrow, 99,309 right pointing arrow, 99,310. Next, we'll examine MDM versus time for subsequent nursing facility care. Now let's look at MDM versus total time for subsequent nursing facility care. For subsequent services, the four codes are 99,307 through 99,310. When selecting by MDM, 99,307 represents straightforward MDM. 99,308 represents low MDM. 99,309 represents moderate MDM. And 99,310 represents high MDM. When selecting by total time, the current thresholds are 10 minutes for 99,307, 20 minutes for 99,308, 30 minutes for 99,309, and 45 minutes for 99,310. The applicable time must be met or exceeded. Remember, do not combine MDM and time to create a higher level. Think of it as MDMOR total time right pointing arrow, select the appropriate code. When using MDM, consider the documented problems addressed, data reviewed or analyzed, and risk of patient management. When using total time, qualifying physician or QHP time on the date of the encounter can be counted according to the applicable captain rules. For the CPC exam, memorize this sequence: 99,307 right pointing arrow 10. 99,308 right pointing arrow 20. 99,309 right pointing arrow 30. 99,310 right pointing arrow 45. And always make sure the documentation supports the method and level selected. The key idea is simple: use MDM or time, document the service, and follow the applicable payer rules. Next, we'll move to nursing facility discharge management, 99,315 and 99,316. Now let's review nursing facility discharge management. There are two primary codes. 99,315 is used when the total qualifying time is 30 minutes or less. 99,316 is used when the total qualifying time is more than 30 minutes. Discharge management may include the final examination, discussion of the nursing facility stay, continuing care instructions, preparation of discharge records, prescriptions, referrals, and communication with the patient or caregiver. For Medicare, the discharge service requires a face-to-face visit with the patient by the physician or qualified non-physician practitioner. The service is reported for the date of the actual visit, even if the patient's physical discharge occurs on a different calendar date. For the CPC exam, remember, 99,315 right pointing arrow 30 minutes or less. 99,316 right pointing arrow more than 30 minutes. Do not confuse these with hospital discharge day management codes. Here's a quick example. If the qualifying discharge management time is 38 minutes, the correct code is 99,316, because the time exceeds 30 minutes. Your memory line is simple: nursing facility discharge right pointing arrow 99,315 or 99,316 right pointing arrow time determines the code. Next, we'll look at the 2026 Annual Nursing Facility Assessment Update and the deletion of CPT 99318. Now let's review an important nursing facility coding update for the CPC exam. Captain 99318 was deleted effective January 1, 2023. CMS confirms that 99318 is no longer used to report the annual nursing facility assessment. So, if an exam question describes an annual nursing facility assessment, do not automatically choose 99318. Instead, for Medicare Part B, the regular nursing facility code set applies. Subsequent nursing facility services are reported with 99307 through 99310, as appropriate to the documented service. Remember that the word annual describes the frequency of the assessment. It does not create a separate current captain code. For CPC preparation, memorize this: 99318, deleted. Current approach: think 99307 through 99310, as appropriate. And always verify the documentation, applicable captain guidelines, and payer requirements. The key memory line is 99318 equals deleted right pointing arrow, think 99307, 99310. This is especially important because older study materials may still show 99318 as an annual assessment code. Next, we'll review Medicare-specific nursing facility coding rules. Now let's discuss prolonged services for nursing facility E coding. For Medicare, prolonged nursing facility services are reported with HCPCS-GO317. This code is used when the primary nursing facility visit is selected using total time and the applicable prolonged service threshold is reached. For initial nursing facility care, the highest level code is 99306, and the Medicare prolonged service threshold is 95 minutes. For subsequent nursing facility care, the highest level code is 99310, and the threshold is 85 minutes. An important CPC point is that GO317 is not reported when the primary EM level is selected using MDM. The visit level must be selected using time. Also, GO317 represents each additional 15 minutes of prolonged nursing facility service, when the applicable requirements are met. For example, if an initial nursing facility service qualifies for 99306 based on time and the applicable total time reaches 95 minutes, GO317 may be reported when all Medicare requirements are satisfied. Remember, 99306 right pointing arrow 95 minutes right pointing arrow GO317. 99310 right pointing arrow 85 minutes right pointing arrow GO317. And don't confuse GO317, which is for nursing facility prolonged services, with GO316 for hospital inpatient or observation services or GO318 for home or residence services. One more important point: Medicare's nursing facility prolonged service calculation uses a specific surveyed timeframe around the visit, so always follow the current CMS instructions rather than assuming that only face-to-face time on the visit date counts. Your CPC memory line is GO317 equals nursing facility prolonged service, 99306 right pointing arrow 95. 99310 right pointing arrow 85. Next, we'll review Medicare-specific nursing facility coding rules and common exam traps. Now let's review some of the most common nursing facility coding traps that can appear on the CPC exam. First, don't automatically use hospital inpatient EM codes just because the patient is medically complex. In the nursing facility setting, use the appropriate nursing facility EM code family. Second, carefully distinguish initial care from subsequent care. 99304, 99306, initial 99307, 99310, subsequent. Third, remember that for the applicable nursing facility EM codes, MDM and total time are alternative methods of selecting the level. Don't combine them to create a higher level. Fourth, remember the per day concept for nursing facility EM services. Fifth, watch for the biggest outdated code trap, 99318. It was deleted effective January 1, 2023. Annual nursing facility assessments are reported using the appropriate subsequent nursing facility care codes or applicable Medicare G codes. Sixth, don't confuse discharge management with subsequent care. 99315 and 99316 are specifically for nursing facility discharge services. 7th, be careful with GO317. For Medicare, verify the underlying nursing facility EM service, the applicable total time requirements, and all prolonged service rules before reporting it. And finally, pay attention to the place of service. CMS identifies POS 31 for skilled nursing facility and POS 32 for nursing facility. For the CPC exam, use this simple workflow. Setting right pointing arrow service right pointing arrow initial, subsequent, or discharge right pointing arrow MDM or time right pointing arrow documentation right pointing arrow payer rules. Most importantly, don't code from a single keyword such as annual, follow-up, 50 minutes, or SNF. Read the complete clinical scenario, identify what service was actually performed, and then select the code supported by the documentation. That approach will help you avoid many nursing facility coding traps. Let's work through a CPC-style initial nursing facility scenario. A 78-year-old patient is admitted to a skilled nursing facility following hospitalization for pneumonia and deconditioning. During the initial visit, the physician evaluates the patient, reviews records and medications, addresses multiple active problems, and establishes a treatment plan. The documentation supports moderate complexity MDM, and the total qualifying time is 40 minutes. Now, which code should we report? The answer is 99,305. Why? This is an initial nursing facility service, so we first look at the 99,304 through 99,306 code family. CMS identifies these as the initial nursing facility care codes. The documented moderate MDM supports 99,305. The 40 minutes also meets the current 35-minute time threshold associated with 99,305 when selecting the service by time. For the CPC exam, use this 4-step approach. Where? SNF. What service? Initial care. What level? Moderate MDM. Code? 99,305. Remember, nursing facility EM services are per-day services, so don't report multiple nursing facility EM services for the same patient, provider, and date simply because several issues were addressed. So the final answer is B, 99,305. The key lesson is: identify the setting first, determine initial versus subsequent care, evaluate MDM or qualifying time, and then select the code supported by the documentation. Now it's time for a quick CPC knowledge check. We have 5 questions covering initial care, subsequent care, discharge management, the deletion of 99,318, and Medicare prolonged services. Pause the video if you need more time and choose your answers before checking the key. The correct answers are 1. B, 99,305. 2. C, 99,309. 3. A, 99,315. 4. D, 99,318 was deleted. 5. B, GO317. Remember the key sequence. Initial right pointing arrow 99304, 99306. Subsequent right pointing arrow 99307, 99310. Discharge right pointing arrow 99315, 99316. Nursing facility prolonged right pointing arrow GO317. The CPC strategy is simple. Identify the setting, identify the service, determine MDM or time, and verify the documentation. Great job! Next, we'll finish the lesson with a final summary and key takeaways. Let's quickly summarize 2026 nursing facility coding. First, identify the setting. POS 31 for SNF and POS 32 for nursing facility. Next, identify the service. 99304, 99306, initial care. 99307, 99310, subsequent care. 99315, 99316, discharge management. Remember, select the appropriate EM level using MDM or total time, based on the applicable rules and documentation. A major exam update is that 99,318 is deleted, so do not use it for an annual nursing facility assessment. For Medicare prolonged nursing facility services, remember GO317, when all applicable requirements are met. Your CPC master memory is: setting right pointing arrow service right pointing arrow initial, subsequent, discharge right pointing arrow MDM or time right pointing arrow documentation right pointing arrow payer rules. Most importantly, code the complete clinical scenario, not just one keyword. That completes our 2026 nursing facility coding lesson. Great job, and keep practicing for the CPC exam.